Okay, let's dive in. We're tackling the knee today, which you could definitely call the hardest working hinge in the body, right?
Absolutely. It's a marvel, but also under incredible strain.
Yeah, think about it. You've got this double whammy of forces, the load coming up from your feet hitting the ground,
Mm.
and then bam, the entire weight of your body coming down onto this one joint constantly.
It's a huge amount of pressure. And what's really interesting, I think, is that the actual joint itself, where the femur, the thigh bone meets the tibia, the shin bone,
Yeah.
it's not a perfect fit. The bones don't mesh together seamlessly.
Huh. So they kind of need something in between, like an adapter.
An adapter, a shock absorber, something to make it all work smoothly.
Okay, so that's our mission for this deep dive, figuring out that crucial piece, the meniscus, right? How
Awesome.
it gets damaged and what treatments are out there now, even for really serious injuries.
Precisely. And that adapter is the meniscus. It's this tough cartilage, basically two C-shaped pieces.
Mm.
The sources describe them like segments of a mandarin orange.
Mandarin orange segments. Ah, okay, I can picture that, like two little crescent moons in there.
That's a good way to think of it. And you absolutely need them for the knee to bend and straighten normally, given that imperfect bone fit we mentioned.
Makes sense. So if it's that important, how does it usually get damaged? I always picture like a huge collision in sports.
Well, that can happen, sure. But often it's something much simpler, a sort of awkward movement, an unexpected twist.
Oh, really?
Yeah, it's often not a direct blow. Think about planting your foot hard and then suddenly twisting your body like a soccer player, making a quick turn.
Right. I can see how that would wrench the joint.
Exactly. That retorcimiento, that twisting force inside the joint, that's what commonly tears the meniscus. Very typical in sports, yes, but also something we see more just with age and everyday movement sometimes.
And the way it tears isn't just one thing, is it? The sources had some really vivid ways of describing the different kinds of breaks using food.
Yes. The analogies are quite helpful because, well, how you treat it depends a lot on how it's broken. Okay, lay 'em on me.
All right. So first, you could just chip off a small piece. Imagine like the little pointy golden tips breaking off a croissant or a half moon pastry.
Okay, little fragments.
Second, it could split right down the middle, like cutting that pastry in half, a more significant tear.
Right.
And the third one, this sounds, well, mechanically tricky. It's a tear where a flap of the meniscus gets sort of flipped over and caught in the joint. The analogy used was like putting a slice of cheese inside the pastry and it getting jammed.
Oof. Yeah, that sounds like it would lock things up immediately
Uh,
and cause a lot of pain.
oh, instantly. Intense pain, often felt right at the front of the knee, but it can radiate to the back too. And then the body's defense system kicks in.
Which is flooding the area.
Pretty much, the knee starts producing a lot of fluid, synovial fluid. It's trying to cushion the damage, trying to, amortize the impact inside.
Okay, that sounds like a reasonable first response,
Yeah.
but the sources seem to suggest this actually makes things worse. How come? Yeah, it's a bit counterintuitive, isn't it? You think more cushion equals good. But the problem is this fluid itself triggers inflammation.
Ah.
And then the inflammation causes the knee to produce even more fluid. So you get stuck in this really damaging, vicious cycle. Fluid causes inflammation. Inflammation causes more fluid. It just keeps building pressure.
A self-perpetuating problem. Okay. And is that where things like Baker cysts come from, all that extra fluid needing somewhere to go?
Exactly right. When the fluid can't escape from the front, it pushes backwards and collects in that space behind the knee, forming what's called a Baker cyst.
And those can get quite big.
Oh, yes.
Yeah.
Sometimes as large as a plum, apparently. And it can feel really hard, like a little stone back there. Very uncomfortable.
Wow. But beyond the swelling and the cyst, the immediate issue is that piece of torn meniscus, right? The cheese and the pastry.
That's often the most urgent problem, yes.
Yeah.
That loose fragment acts, quite literally, like a stone in your shoe, but inside your knee joint. It gets wedged in the mechanism, in the gears.
So the knee physically locks up. You can't straighten it.
Correct. The joint gets blocked.
Yeah.
You try to move it, and clunk, it just stops. It's mechanically impossible because something is physically jammed in there.
So what's the first step then? You have to somehow unjam it.
Precisely. If the knee is locked because of a displaced fragment, the first thing we try is often an unblocking maneuver.
Which involves?
Specific hands-on techniques. Manual therapy, where a skilled therapist will carefully manipulate the knee, trying to coax that lodged piece of meniscus back into a less problematic position.
Yeah.
Basically trying to get the stone out of the gear mechanism.
Okay, so a physical fix first, if possible.
Always try that first if it's locked. But dealing with the immediate blockage is just part one. The longer-term recovery, That involves something else that's really critical. It's about supporting the joint from the outside.
Ah, right, like building scaffolding around a shaky building.
That's a perfect analogy. You strengthen the external structures to take the pressure off the internal damaged parts. And for the knee, the absolute key external support muscle is the quadriceps.
The big muscle group on the front of the thigh.
Exactly. Runs from up near your groin, down the front, and connects around the kneecap. It's fundamental for stabilizing the knee. But here's the kicker, the really crucial warning.
Uh-oh.
After a knee injury, or even just being immobilized for a bit, that quad muscle weakens incredibly quickly. We're talking significant strength loss in maybe just 15 days.
15 days, that's alarmingly fast.
It is. But getting that strength back, that takes months, many months of dedicated work.
Wow. Okay, so that imbalance, quick to lose, slow to gain, is a major hurdle. So for anyone listening who's gone through this or wants to protect their knees, what's the takeaway? Nonstop exercise.
Pretty much relentless consistency, yeah. Yeah. Because it takes so long to rebuild, you need specific exercises, often things like quad sets, straight leg raises, maybe low impact resistance. And you need to do them multiple times a day. 2-3 times every single day.
Even at home or at the office?
Absolutely. You can do many of them anywhere. The goal is to build and maintain that strong muscular corset around the knee to support it. And crucially, you can't wait for the pain to go away before you start. You have to rebuild that support structure as soon as possible.
Got it. Build the external support immediately. Okay, so that's the outside. What about fixing the damage inside the joint? You mentioned the meniscus doesn't heal well on its own.
Right. That's the other major challenge. Our bodies usually heal using blood, right? You
Yeah.
get a cut, blood flows, brings healing factors, forms a scab.
Yeah.
But the main parts of the meniscus are largely avascular. They don't have a good blood supply. So those natural repair kits carried in the blood just can't get to the damaged area easily.
So the body's own repair system is blocked off. What's the workaround then?
We have to find a way to artificially deliver those healing factors right where they're needed. And one of the leading ways to do that now involves using the patient's own blood in a concentrated form.
Ah, this is the platelet-rich plasma, the PRP therapy I've heard about?
Exactly, PRP. The concept is actually quite elegant.
How does it work, step by step?
Okay, so first you draw a small amount of blood from the patient's arm, just like a normal blood test.
Simple enough.
Then, in a lab process, that blood is spun down in a centrifuge to separate out and concentrate a specific component, the platelets.
Platelets, aren't those involved in clotting?
They are, but they're also packed with hundreds of proteins called growth factors. These are the crucial signaling molecules that initiate and accelerate tissue repair, the soldiers that rebuild things.
Okay, so you concentrate the soldiers, then what?
This is a key step. These concentrated platelets need to be activated. They're kind of dormant until they receive a signal. This activation is often done by adding a substance like calcium chloride just before injection.
Right, gotta wake them up.
Once they're activated and ready to release those growth factors, this platelet-rich plasma is injected very precisely, often using ultrasound guidance, directly into the damaged area of the knee, the torn meniscus, or perhaps areas of cartilage damage.
So you're delivering the healing instructions right to the spot that can't get them naturally.
That's the idea. Stimulate repair in an area that otherwise struggles to heal on its own because of that poor blood supply.
And is PRP usually done on its own, or is it part of a bigger picture?
It's often part of a combined approach. You might have the PRP injections to stimulate the biological repair, maybe alongside injections of hyaluronic acid, which acts like a lubricant for the joint, helping it glide more smoothly. It's about tackling the problem from multiple angles.
Makes sense. Repair and lubrication. Now, before we wrap up the treatment side, you mentioned something really important earlier about pain, and the sources warned against just masking it.
Yes, this is absolutely critical. Painkillers, or even just relying on ice or heat to numb the pain temporarily, they can be really counterproductive in the long run.
Why is that? Isn't reducing pain a good thing?
Well, yes and no. Pain serves a vital purpose, especially after an injury. It's your body's alarm system. It's shouting, "Stop! Something is wrong. Don't put weight on this. Don't twist like that."
It's a protection mechanism.
Exactly. And if you just switch off that alarm with painkillers so you can push through,
Yeah.
well, the source material had a really powerful analogy for this.
Oh, yeah.
It said taking painkillers to keep playing on an injured knee is like being in an airplane that's losing altitude. Alarms are blaring. And you just put black tape over the warning lights on the dashboard.
Ooh, yeah. That paints a picture. The plane is still going down.
Precisely. The underlying damage is still there, potentially getting worse because you're using the joint in a way it can't handle. Masking the pain can let you turn a small possibly repairable tear into a much larger, more complex injury that might end up needing much more invasive surgery or might not be repairable at all.
So the message is, listen to the pain, stop, get it checked out properly. Don't just silence the messenger.
Absolutely. Get a proper diagnosis, understand what's wrong, and then start the right kind of treatment and disciplined rehab.
Okay, so pulling this all together for someone facing this, a full recovery really depends on a sequence of things, doesn't it?
It really does. It starts with a thorough checkup by a specialist, usually a traumatologist or orthopedic surgeon. Then, you almost always need imaging, typically an MRI, to confirm exactly what's torn and how badly.
Get a clear picture.
And based on that, you need a tailored treatment plan. That might involve those manual maneuvers we talked about if the knee is locked.
Right, the unblocking.
Definitely that consistent, dedicated muscle strengthening, focusing heavily on the quads
The external support.
and potentially these newer, innovative therapies like PRP to promote healing from the inside. It's often a combination.
A multi-pronged attack, really. And the goal isn't just to be pain-free, is it? It's about getting back to life.
That's the ultimate aim, whether that means an elite athlete getting back to their sport or someone just being able to walk comfortably, climb stairs, and do their job without pain or limitation.
Yeah.
It's about restoring function.
So thinking about that bigger picture, you mentioned how incredibly fast those support muscles, like the quads, weaken, like just 2 weeks.
Yeah, it's stark.
And then it takes months for the biological healing and the muscle rebuilding to happen. It makes you wonder how much of keeping our joints healthy, maybe even preventing these injuries in the first place, comes down less to miracle cures or complex surgeries and more to just the daily grind.
Yeah.
That consistent, maybe boring work of keeping those supporting muscles strong and being aware of how we move before anything goes wrong.
That's a really powerful thought to end on, isn't it? How much relies on that mundane daily discipline of preventive strength and awareness. Rather than waiting for the dramatic injury and then scrambling for a fix, maybe the best intervention really is the one you do consistently, day in, day out.
Food for thought, definitely. Well, hopefully this deep dive gives everyone a new appreciation for those crucial little mandarin orange segments inside the knee and how to best look after them.